Hello everyone. So today we are going to discuss about glanders. Glanders is a very contagious and fatal disease of equids mainly, but it also affects other animals and humans. Hmm. So the main names of the disease that may be different in different countries and continents. Such names are Farcy, Equina, Malleus, or Rotz. Yes, probably it seems like Rotz. Okay, so move on. The earlier description of this disease dates back to 425 BCE. That makes it one of the most earliest described disease of animals. So the disease is very contagious. Disease of solipeds. Solipeds means single-toed animals that has only one toe in their feet. Uh-huh. Most of the zebras, most of what? Not most of all. Zebras, donkey, equids, horse, giraffe, or most of the solipeds. You can just Google it. What are solipeds? So it is said that the Germans in World War One used it against Russians. So it was a very contagious and fatal disease. So they might have used back then. But it's just said. God knows what's the reality. So the characteristics of this disease are nodules and ulcers. Of course, in equids, we are talking about equids. Yes, we will talk about mainly equids because it's the main disease of equids. So, etiological organism of this disease is Burkholderia malleii. It's also named as Malleococcus malleii or Streptococcus malleii, but the most latest and famous name is Burkholderia malleii. Don't pronounce it wrongly; it may have consequences. So, the Burkholderia malleii is a gram-negative rod-shaped aerobic non-spore-forming bacteria. So, the glanders is mainly present in Asia and Africa nowadays. Yes, now it's mainly present in poor countries like those are present in Asia and Africa, and has been eradicated from US and UK. Like most of the developed countries have a good eradication programs of such diseases, whereas poor countries mostly fail to eradicate them completely. We'll discuss some other day why it happens, what are the consequences, what are the loose ends. So the disease, the most important thing that makes this disease so dangerous is the zoonotic importance of this disease, and then after it is one of the most contagious and one of the most fatal zoonotic diseases. The infection to human is mostly fatal. Yes, mostly, that I mean more than 90% cases the patient is terminated as death, and the cause of death is acute fatal pyemia. So here you can see some scientists or doctors that are working on a horse that has been affected by glanders, and you can see they are in full protective gears and they are not risking their life because this disease is very fatal. Yes, to the humans it's very fatal, to the horse too, but humans are very susceptible to fatality. Okay, so in next slide we will see two more photos of horses that are affected from glanders, and you can see the first one shows a swollen lymph node in the hind limbs that you can clearly see. I think you can, I hope. And in the second picture you can see the swollen lymphatic cords or lymphatic vessels. There is clear indication of such disease like glanders. Okay, so in the next slide we will talk about the spread, how the disease is spread from one equid to another or one equid to another animal or human. So the disease mainly is spread via oral route, that is by ingestion. Contaminated fodder, mostly water troughs, and various means of transmission out there. One of the most important means is grooming. When you groom a horse affected with glanders that had been oozing out pus from its fistulated, ulcerated, and lymph nodules. So those pus have a causal organism Burkholderia malleii, and when you groom with the same comb to the another unaffected horse, it may get infected. And infection is often fatal. And cats and dogs are not actually natural hosts of this disease, but they get infected when they eat on raw flesh of such a decaying and decomposing equine carcass. These are the consequences when someone don't dispose the carcass properly. because if a carcass that has been affected with a contagious and very deadly disease, it has to be handled very, very carefully and should be disposed of by burning it. It's a recommendation, of course. Humans working with such affected animals should be very, very, very cautious because it is a very contagious, very fatal disease and may cost lives. So let's talk about pathogenesis. Pathogenesis, the development of disease. The development of disease is called pathogenesis. So it's a science, it's an art, whatever you name it. So organism usually gets entry by invading mucosa of gut, that is after ingestion, of course. So after getting entry into the blood, it may proceed in two ways. The first way is septicemia, the another is bacteremia. The first is called septicemia, that is most of you know that septicemia is called as a bacteria along with its toxin into the blood that may cause acute death with the limited signs and symptoms. Whereas the another bacteremia, the way of bacteremia may proceed in chronic disease. And let's move on. Lung and respiratory mucosa are the most common sites of lesion and infection. So when you talk about lungs, when you open the affected carcass for necropsy, you will definitely see granulomatous nodules that resemble tubercle-like. So what is granuloma? It's a tissue that is congested, that is necrotic, and it's differentiated from the surrounding tissue as there is a wall of not a wall but a demarcation. There's a distinct demarcation among other surrounding tissues and the granulomatous tissues. That is why it's called granuloma. So granulomatous nodules get formed inside the lungs. Infection in lung terminate as bronchopneumonia, and when there is a profused and severe bronchopneumonia, the animal is unable to breathe properly, and the oxygen that is it's taking into the lungs, it's not delivering to the blood, and the death commonly occurs to anoxic anoxia. So let's move on. Let's talk about sign. What you will see in a glandular affected horse. Signs are the very important criteria for treatment in veterinary diseases, as the patient cannot tell you the symptoms. So you are solely dependent on mostly signs. So in the acute form, there will be high fever, cough, nasal discharge, and ulceration in the nasal mucosa, swollen lymph nodes, and high limb on the high limb, and death due to septicemia. In short, I will tell you that when you get a case, it's mostly a dead horse. Yes. In acute form of glanders, you mostly get a dead horse, and what you see in the post-mortem lesion that are mostly swollen lymph node in the hind limbs, and when you check the blood, it has a high bacterial load and toxin load. Okay, so let's move on to the chronic form. So in the chronic form, you get a history of chronic cough, okay, and epistaxis, that is nosebleed. You can see it or you can just get from history that the horse often bleeds the nose. The respiration is mostly labored, and the nasal and skin form occurs frequently together. Ulcerative nodules on the lower part of turbinate, and those nodules may heal and form a scar that is stellate shape. We'll discuss it. Okay. Serous nasal discharge that later becomes purulent. So in the beginning, the discharge is mostly serous and do not contain pus. As the disease progresses with time, the discharge becomes purulent and contains pus, and pus contains organism, and this may transmit the organism to other unaffected individuals. It's mostly preferred that the horse affected with glanders is simply executed. Yes. And culling is the best option to just stop the spread of glanders because it's very contagious and very fatal. So you hardly or barely can save one horse in herd of many. Whereas the objective of treatment should be, the objective of veterinarian should be that of saving more lives than just one. So it is preferred to cull such horses that are affected with glanders. So yes, a large maxillary lymph node is common finding. The maxillary lymph node, that are above the neck, they are mostly swollen. Stellate scars are, pathognomic lesions. Okay, so the skin form is characterized by subcutaneous nodules, mostly on the medial side of hog joint. Most of you all already know where's the hog joint. I don't need to discuss that. So subcutaneous nodules are there found. Lymph nodules ulcerate and discharge pus that oozes out, and it looks like a fistula. That's called fistulous tract on the skin. Most of you probably know what is fistula. There is a cavity or hole, a hole through the body cavity is called fistula. Fistula in many organized forms. The human fistulated animals are there just to avoid bloating and get good results. Yes, that's called fistula. So let's talk about lesions. What you will see. Okay, so deep erosion in the nasal mucosa. Erosion is like peeled off skin in the nasal mucosa, and the eroded area is mostly very congested. And as the scar heals, it leaves behind a stellate shaped scar. As the ulcer heals, it leaves behind a stellate scar. That is most common finding and pathognomic sign of this disease, stellate scar on healing of ulcer. Yes. So granulomatous nodule in the lung contain caseous necrotic center surrounded by chronic inflammatory cell. So when you examine microscopically the lung tissue in the nodules, you will get a caseous center that is surrounded by chronic inflammatory cells. Probably you know what are the chronic inflammatory cells: lymphocyte, neutrophils, macrophages. You guys should check and Google it. I'm not quite sure. Sometimes granuloma are seen in liver, spleen, and other organs too, but they are most frequent, lungs. Skin lesions show superficial lymph nodules on leg discharging tenacious pus. Okay, indolent ulcer that do not heal so quickly. So the most important thing is diagnosis. What you will, the main objective is to diagnose the disease and cull the animal as soon as possible, as clearly and gently as possible. Yeah, there are many ways to cull the animal. Some are gentle, some are rough. Okay, so Malin test is a test that uses protein malin. This protein is instillated in the eye of suspected horse. If the horse is affected, the eye will get congested and conjunctiva will get swollen. If it is unaffected, it will not occur and conjunctiva will seem to be normal. And